Hey Gen Z, and welcome to the PHYSIODCAST, a one-time real talk with us, the Gen Zers, on the many things that today's generation have a hard time being honest about, or simply things they want to talk about, especially their health and wellness. I am one of your Gen Zers, Marie Zambrana, ang inyong residenteng bidang-bida, extra-extra, andito para sa iyo hanggat walang hanggang.
Generation Z. Who the hell are they? Oh, nagets nyo ba yon? Ang galing ko doon. I'm Angeline Bautista, ang inyong Gen Zer na kayang-kaya, handang-handa at pwedeng-pwede na ipaglaban ka.
Loving the energy today, Gen Zers! Siyempre, finishing strong, ganun din kalakas ang pagmamahal ko sa inyo. I'm Junata na ang inyong Gen Zer girl boss, nagigil at hindi katatantanan. Today in PHYSIODCAST, we will dive into the different things about health and wellness, pero ano nga ba yun?
Yes, so to everyone who is listening to us right now, just sit back, listen, and relax. Please do suggest to your friends also to join us today. Really aim for a safe space for everyone as well as provide the right information, especially about things with our bodies, how we can take care of it, and how to be more aware for anything you need to look out for.
Okay, so to start, we call this segment, Ano Chichi Mo Be? Ayan, we will be addressing some concerns from our listeners on many different topics that we can talk about with health. So for this, we have invited some guests who will help us guide with everything that we have to know and deserve to know about.
So, let us welcome Dr. Janina Santillana and Dr. Kalia Estrada from Archer's Medical Center.
Hello guys, I am Dr. Kadi, a practicing OB-GYN at your service. Excited to be with everyone here today to share my insights about safe sex.
Hi everyone, I'm Doc Nina, also an OB-GYN, and I am honored to be here to listen and give advice to you guys today.
It is an honor to have you both here, mga doktoras. I'm just super confident that we'll be learning a lot from you guys.
Yes, Doc Nina and Doc Kali are one of the top doctors in their field. Plus points dahil they're very open, kaya sakto-sakto talaga sa podcast natin.
Wow naman! That's good to know. Again, to our very pretty doctors, and welcome to PHYSIODCAST, a Gen Z safe space.
Ayan mga ka-Gen Zs, if you have any queries, you can send us a DM at @physiodcast.ph because we are now accepting questions or concerns you want to ask our beloved guests.
Ayan, huwag kayong mag-hesitate mga ka-Gen Z because we remain anonymous naman if you want to consult with our guest speakers. Just include your age, sex, and health concern, kaya tara na!
Mommy! Ito! Wait lang anak, nagmimit pa si baby. Wait lang anak. Nagtitis pa si mommy. Dad, tapos ka na ba sa work? Nag-aaral ka pa. May exam ka bukas. Okay. This portion is brought to you by Tiwala Condom. Better safe than sorry. Better to be ready than to be a daddy.
Uy, ayan na guys, may nag-DM sa atin. Ang bilis ha? Here's what she sent us. I am a 20-year-old female and lately I have been suffering from acne, especially on my back and my face. I also have missed my period for a couple of months now, when normally I have my period regularly. Plus, I gained weight and I am not sexually active. I am worried because from what I am hearing, it is possible that I might have PCOS. If I do have PCOS, what possible treatments can I take?
Nako, it looks like our sender is very worried na talaga. Doc Kali and Doc Nina, what can you tell us about her case? Marami nga rin ako nahinig na ganitong cases today. And maybe sa mga listeners natin, marami rin nakaka-relate.
Thank you for that, Angge. Alam mo, PCOS is a prevalent issue talaga among young ladies and teenage girls. It is actually a hormonal imbalance that can lead to irregular menstrual cycles, unwanted hair growth on the body and face, and acne. Any woman can have PCOS. It especially develops in her 20s or 30s, and minsan nga kahit as young as 11 and 12 years old, pwede, basta at the start of their first menstrual period. Right, Doc Nina?
That's right, Doc Kali. PCOS is a disease affecting most endocrine organs. So, including to yung ovaries, adrenals, pituitary, fat cells, and even the pancreas. The manifestations of PCOS is very diverse, and up to 50% of patients are normal weight. But obesity is also a finding for PCOS. So proper diet and having a good lifestyle is needed talaga. And you should also get yourself checked as pills are also used as a form of management. And PCOS unfortunately has no cure, but manifesting symptoms can be managed.
Oh, I see. Thank you for that, Doc Kali and Doc Nina. Answers pa lang nila sa first concern ni sender. Ang dami ko na agad natutunan today. And I'm sure that our sender and other audience have gained knowledge and awareness about PCOS too.
I agree with you, G. Ito naman, we have another message. I am a 21-year-old female and I am worried about inheriting breast cancer since 2 women in my family have already been diagnosed with the disease. Is there any way I could prevent getting it? What should I do to ease this anxiety?
Well, to ease your anxiety, I suggest that you consult your doctor or have regular checkups. Because if you have a family history of cancer, mas mataas yung chance of getting it in your 20s. For breast cancer naman, you can self-assess and check if may lumps pa. For self-assessment, hindi mo naman kailangan ng fancy equipment. You can do it in the bathroom or laying down.
Yes, Doc Ali. Once a month, 10 days after your menses, kapakapain mo lang each breast circularly, vertically, and then from outside to in. And also check if your nipples are producing discharge. But overall, it is really best to check with a medical professional. Once in your 40s, a mammogram and a breast ultrasound once a year is also suggested.
Wow, I see. Ganun pala yon. Early prevention is key talaga. Kaya to our dear listeners na mga girls, have yourself checked na agad when you notice na the symptoms, gaya ng mga sinabi ni Doc para maagapan.
Ikaw ba, Maris? Nagpa-check up ka na ba?
Ayun nga, G, hindi pa. Pero thanks kina Doc at ngayon mas aware na ako sa breast cancer and yung importance na we also get checked regularly.
Ito naman, may isang sender na may concern about safe sex. I am a 56-year-old female who just got into a relationship with a 60-year-old male. Despite our age, we still want to be sexually active, but I am in my menopausal stage and he is in his andropause stage. What should we keep in mind before we engage in any sexual activity?
Oh, ayan. Hindi lang mga taga Gen Z ang welcome here. Anyone can address their concerns here sa safe space ng PHYSIODCAST.
To our dear doctoras, ano po bang mga advice niyo sa concern ng aming third sender?
Before answering your question, let's first explain what menopause and andropause is. Menopause is yung point in time na 1 year after a woman's last period. And andropause is the point in the male's life that his testosterone levels start to decline, which starts at the age of 40.
Now, being sexually active is important as it promotes vaginal health and even after menopause. But due to your age, don't expect sex to be like in your 20s kasi as we age, there is a decrease in libido talaga. Menopause can also cause vaginal dryness, which can make intercourse a bit painful. So, it really is suggested to use lube. So, before you engage in sexual activities though, keep in mind na don't be too hard on yourself and do what's best for you and your partner.
This podcast is brought to you by Brilab International, your trusted leading pharmaceutical and healthcare company in the Philippines, developing, manufacturing, and marketing over 300 prescription over-the-counter and personal care brands. Basta Brilab, sigurado at protektado.
Again, we would like to thank our main sponsor for this podcast, Brylab International, along with Tiwala and Archer's Medical Center, for making this safe space possible for all, especially for our Gen Z listeners.
Now, moving on to our fourth sender for today, looks like it's a follow-up concern about safe sex. Ang sabi niya, I'm a 22-year-old female college student and my sister gave me a lot of advice with birth control methods, but I've always doubted their effectiveness. I want to use contraceptives and I don't want to worry about getting pregnant every single time. Is there any other advice you can give me about contraceptives?
What are your standard birth control methods that is available in the Philippines? Kung kadalasan kasing naririnig natin ay pills or birth control pills or condom, but there are other options such as IUDs or injectables. The effectivity of the contraceptive is dependent on its if it's used properly. I always say this to my patients that even though you have these birth control methods, it's best to always use a condom, especially if you're engaging in sexual activities, kasi this may prevent you from getting pregnant, but it doesn't protect you against STDs. But I would like to remind our listeners that when choosing these options, make sure to consult a gynecologist in order to choose the best contraceptive that is suitable for you. Condoms are readily available and can be bought in convenience stores. It's a one-size-fits-all. Oh, paalala lang ha, condoms are not reusable. I let Doc Nina tackle the options naman for women.
So, ang pills naman or birth control pills are around 91 to about 98% effective in preventing pregnancy. And this is because it stops you from ovulating. And if wala namang ovulation, then the sperm has no egg to fertilize. And as mentioned, it can also be used to regulate hormones, like in cases of PCOS. Another option would be IUDs, which are more than 99% effective. And there are two types, which is copper and Mirena. So these can cost quite a bit, but copper IUDs, as far as I know, are inserted for free sa ibang mga health centers dito sa Pinas. And this can prevent pregnancies for about 10 years. So these require a doctor's prescription and should only be administered by medical professionals. So again, consult your doctor and be responsible rin, especially sa IUDs as they expire and need to be replaced. And lastly naman, injectables. So this is administered every 3 or 2 months, and like in pills, this prevents pregnancy by preventing ovulation. And for this, a prescription is required.
Ayan mga ka-Gen Zers, I'm sure naman na meron kayong bagong impormasyon na natuklasan. And always remember to practice safe sex, ha? Alam nyo ba, mahal ang gatas ngayon.
Correct ka dyan, Maris. Family planning is key talaga. And so, this one is our last but surely not the least entry from one of our senders. Ngayon naman ay from a male. I'm a sexually active male in my early 20s. Knowing that STDs are rampant these days, how can I ensure that my partner is clean? And what are the significant or different STDs I can contract?
Oo nga naman no, Angeline. Not only males can spread STDs. What are your thoughts on this concern po, Doc Kali and Doc Nina?
Okay, so bago natin sagutin yung question na yan, I think importante muna na malaman ng ating listeners kung ano nga ba ang STDs or sexually transmitted diseases. They're also known as sexually transmitted infections na nakukuha or napapasa through sexual activities such as vaginal, oral, and anal sex. But actually, guys, you don't even have to go all the way to get an STD kasi some STDs like herpes and HPV are spread by skin-to-skin contact. May iba't ibang uri na STDs, but to name a few, HIV, syphilis, gonorrhea, and marami pa. If only we have enough time to talk about all of them, no?
Marami pa talagang type of diseases under STDs na need talaga tandaan ng ating mga listeners. And most STDs actually affect both men and women. But in many cases, it's more severe for women. For example, if a pregnant woman has an STD, it can cause serious health problems for her baby. Since sexually transmitted diseases usually affect initially the genitals, then the reproductive tract, the urinary tract, yung oral cavity, and even the anus, but may mature in the body to attack various organs and systems.
Symptoms of STDs vary per disease. So sa mga na-mention ko kanina tulad ng HIV, you may experience fever and headaches sa early stages. These symptoms occur within a couple of weeks to a month or two after being infected.
Like for example, for gonorrhea, common symptoms include yung discharge, burning during urination, unusual sores, or rash. Nako, kaya if you're experiencing these now, stop having sex muna and consult your doctor immediately. And normally naman kasi, the course of treatment is antibiotics. But listeners, if you feel as if you have contracted these, again, have yourself checked and make sure to be responsible and also inform your partner or partners if ever you do get an STD so they can also get checked and treated as well. And STDs are also a reminder to always use a condom when engaging in sexual activities para sure kayo na safe. And by the way, listeners, yung mga na-mention namin ni Doc Kali na STDs are the most common ones, so I hope you took note of them.
Thank you so much for that answer, Doc Kali and Doc Nina. I'm sure our listeners are now well informed about STDs.
Yeah, to our dear listeners, we hope you were able to learn something on this episode of PHYSIODCAST, a Gen Z Safe Space. Kasi kami ni Marisa at Janelle, marami talaga nalaman and natutunan today.
I agree with that. Special thanks to our beloved guests, Dr. Estrada and Dr. Santillana, for giving us reliable information about the health concerns sent by our listeners. Thank you so much for making this safe space possible.
Thank you also for having us. It is our pleasure para naman magkaroon pa ng knowledge ang mga listeners natin sa mga current health problems din na laganap in this generation.
And that's right. And we really enjoyed our time here sharing what we know about the concerns that they have. And again, please consult your doctor or specialist when you're starting to notice symptoms para agad na kayong maagapan before it's too late.
Thank you so much, Doctoras. Now, ang key takeaway talaga for today's video ay listen to your body, Gen Zs. Thank you again for tuning in and don't forget to follow us on Instagram at PHYSIODCAST.ph.
See you on our next episode, Gen Zers.
Bye!
Bye.